Yes. So today is a very dynamic session. This is going to be a very extraordinary session. Yes. Right. Okay. So, yeah, good evening, Suma, Maria. Good evening, Meera, Manoj. I am going to give you some words and you are going to make sentences using that one. So how are you going to use those words? Is very important. Good evening, Pranita. Yes. So, right. Very special session. Because normally I don't come live with video like this because this is interactive session. This is more interactive session. Yeah. So these are specially focused for the exam going students. Yes, that's what it is, Meera. So whoever is going for the exam, they'll get a lot of benefit from this session because I'm going to provide these things today. Yeah. So now the first word for today is, okay. You can say, yeah, definitely. You'll always be in our prayers. So, yeah. Yes. Now let us see the words which we are using on a daily basis. We are going to use the special words. We are going to use special words. How to use these words? So the first word is refer. Many people do not know that this is a very extraordinary word. This is a very extraordinary word. Refer is actually C2 vocabulary. Refer, C2 vocabulary. So how are you going to use? Yeah, good evening, Amira. So how are you going to use this word refer when you are speaking to a patient? Speaking session. We are bothered about the speaking session. How are you going to use the word refer? If any complication arises, you will be referred to a specialist. Because as of now, we don't foresee any such conditions. Therefore, things are slated to be normal and manageable. Unless and until there is some serious condition, referral to a specialist will not be provided. If it is beyond our understanding, capability, and scope, if it is beyond our perception, understanding, capability, and scope, then only we will refer to a specialist. Otherwise, we are going to manage everything. So you can use unless and until complication arises. Okay, right. So now I want you to write the word with the refer. How are you going? See the condition I'm telling you already. Okay, I'm telling you already. I want to be referred to a cardiologist. I want you to refer me to a cardiologist. I have, the pain in my heart. I want you to refer directly to a cardiologist. Now, how you are going to deal with it? No, I don't want to take any risk. This sometimes there is some sort of panic and my heart beats very fast and I don't know how to manage this condition. So I don't want to take any risk immediately. No problem. Money is not a big issue. I want to be referred to a cardiologist. Now, you are a nurse or you are a doctor. You are a general physician, GP, general practitioner, or a general physician, or you're a doctor. Okay, you're not specialist. So he's telling you like this. There is some problem to your heart. He knows heart means cardiologist. That only he knows. So now you have to talk with him. Do not worry. We are going to confirm whether it is needed or not. So if a nurse, I'm not the authorized person to discuss these things. The general physician will observe, he will give some tests, then he will recommend you if necessary. Otherwise, everything will be managed perfectly well. Trust us, you are in safe hands. How does that sound at the end? That's it. So how are you going to use this word refer? Number one, come on, write your sentences. I have given you my points. You can write your sentences using the word refer. So, yes. Give your sentence, please. Yeah. So, what is the roll card? There is no roll card. You have to use the word refer. That's all. Word, using the word refer. So, your patient is coming to you and you have checked him and he's asking me, refer me to a cardiologist. You just told him you have some problem with your heart. I will send you for a scan or something like that. Then he will say, no, send me to a cardiologist. I want some special tests. So please refer me to a specialist in heart, a specialist doctor who can treat my heart problems. Yeah. Write your sentences. How are you going to write your sentence? One sentence enough. You can add a prologue and you can add an epilogue. That means before one sentence, final one sentence you can say. So for example, if any or in case, in the event of, in case, if there is any complication, in the event of any complication, in the event of any complication. So that is how you are going to write. In the event of any complication, we will refer, or a referral to a cardiologist will be provided. Full stop. In the event of any complication, a referral to a cardiologist will be provided. If need arises, in the event of. So I'm giving you different sentences. How you are going to how you are going to create your own sentences. If there is any complication, we will refer to a cardiologist. Unless and until any complication arises, we are not going to refer to a cardiologist. So you can talk negative, you can talk positive, any type of sentences you can talk. Yes, Chaitra Gowda, very good. Thank you very much. I am referring Mr. John in your facility, to your facility for further assessment and management. Okay, right. So you are talking to a patient. So this is not the sentence you will tell the patient. So you can tell, yeah, this sentence is right, no problem. This you can use in writing because you are writing to another medical professional. That's right, sentence is right. But you can use also for speaking. Yeah, our focus is on speaking today. Okay, you can write sentences for writing also. Dr. Farid, Peter, after examination, your signs and symptoms, not sign and symptoms, signs and symptoms are suggestive of heart attack, and I am going to refer you, cardiologist. I am cardiologist, refer you to. So here you have to be careful. You are writing in some, internet language or message like you are and you. That's not fine. So you have to write in full words. Okay, to a cardiologist. Manasa, Godadi Manasa. Yeah, I have referred you to the cardiologist as per the GP's advice. GP's, general practitioner's advice. Write in full form. Okay, write in full form. Yeah, for further management. Very good. Come on, write down your sentences. Participate actively. Participate actively. Write down full sentences, all of you. I'm going to give you a lot of practice. Yeah, that's only the first word. That's only the first word. I'll see your words. I'll see you who is active. Everything I'm going to see here. And if necessary, I'll ask you to speak also. So that is the first word. The next one, use my other computer because I'm using a different mode of Zoom today. So I'll take C2 vocabulary from my Telegram network. Yeah. Yes, the number of C2 vocabulary. Yes. Cambridge. Yeah. Those who are participating in today's session will get a lot of practice how to use this. Yeah. So, yes. Right. The first word is, yeah. So let me take it here. Yes. Legacy. Number 2. Word number 2 is legacy. Legacy means, legacy. What do you mean by legacy? Yeah. Legacy means something that is a part of your history or that remains from an earlier time. A legacy means history, the past history. Something that is a part of your history that remains from an earlier time. Okay, so you can use this word. Okay, the Greeks have a rich legacy of literature. All right, my ancestors have a rich legacy of disease-free life. Legacy, history. This is the C2 vocabulary. Legacy of fortune, righteous life, dietary regimen. Then, so you can use the word legacy. That is number 2. Number 3. Number 3. Detrimental. Detrimental. What is this? Detrimental is also C2 vocabulary. Detrimental. Instead of saying harmful, you can say detrimental, C2. C2. Detrimental. Non-compliance to medication regimen is definitely, undeniably detrimental for your health and hampers your progress. Hamper. I don't know what this vocabulary is. Hamper. Hamper means obstruct. Maybe C1 or C2, definitely. Hamper. To prevent something doing something easily. Hamper. To prevent someone. Okay, detrimental is C2 vocabulary. Detrimental, harmful, dangerous, disastrous, problematic. Okay. So try to use this word. Try to use this word. Detrimental, C2 vocabulary. Yes, detrimental. Use this in writing, use this in speaking. Okay, no problem. Use one sentence in writing, one sentence in speaking, no problem. Detrimental. Non-compliance with medication is undeniably detrimental to your health and hampers the recovery process. Okay. Now let us take the word undeniably. Undeniably. Undeniably is C2 vocabulary. Number 4. Number 4. Undeniably. C2 vocabulary. So you can use these two things together. Okay. Compliance. So 3 words. Compliance. 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 Okay, comply. Comply is C1 vocabulary. Comply is C1 vocabulary. So this is C1. Compliance. Why is it going to C2? Is it going to only waiting room participants? Who is there in waiting room and why it is going there? Oof. Sorry, all of you. So everyone in meeting. Yeah. So now let me recover all these words. Yeah. I have to give you these words. Why it is going to waiting room? Okay. Number 1 is the word refer. Refer is C2 vocabulary. Refer is a C2 vocabulary. Refer somebody to something. And if writing or information, not this one, actually it is C2 vocabulary. Yeah, to direct someone or something to a different place or person for information. It is C2 vocabulary. Number 1, refer is a C2 vocabulary. C2 vocabulary. Yeah. Right, C2 vocabulary, that is CFR. CFR rating, Common European Framework for Languages vocabulary. If you use C2 vocabulary, you will get 400 and above marks. If you get C1 vocabulary, you will get 350 above marks. So that is Cambridge Dictionary will tell you what is C1 and C2. So refer, use the word refer. So one word is refer. Number two word is, what is the second word? I am going to use all these four words in one sentence. So second one is detrimental. Detrimental. That is also C2 vocabulary. C2 vocabulary. Detrimental is also C2 vocabulary. Number three, comply. Compliance, comply. This is also C1 vocabulary. C1 vocabulary. And the fourth one is refer, compliance. Then what is the other word? Undeniably. Fourth one, undeniably. Undeniably. This is also C2 vocabulary. So these four words I'm going to put in one sentence now. Non-compliance to medication regimen is undeniably detrimental for your health, and if complications arise, a referral to a dietitian will be provided. All the four words, see the quality of the sentence. You will definitely get 450 plus. Accepted. You are an A grade student, no doubt. So, try to use these sentences. These are very, very special sentences. Very, very special sentences. Many people don't know these words, that they are very powerful. So, once again, I repeat the sentence. Non-compliance with dietary regimen is undeniably detrimental to your health. And if the complication arises, a referral to a dietitian will be provided. There are other words also. Okay. Complication. Now, what is complication? Complication is not a very special word. Complication is C1 vocabulary. Yeah, I can use it. Complication, I thought it is B2. Complication is C1 vocabulary. That is another word, fifth word I have used in the same sentence. Why don't you use this style? Try to learn. Try to learn. Complication, arise. What is the power of this word arise? Arise is a C1 again. See, many words are there. Many words. You can take the sentence as it is, and you can use in your speaking session. Instead of dietitian, it will be a podiatrist, or it will be a physician, or it will be a physiotherapist, or it may be a dietitian, or it will be a general physician, or it may be a social worker, whatever it is. You can use the same sentence by changing the labels, that's all. You can just change the labels. Many students are getting A grade, you have seen. Why can't you get? Why can't you get? Definitely you can get if you work a little harder. So arise is sixth one. See, I was thinking only 3 or 4 words, but there are already 6 words now. Arise is a C1 vocabulary. Arise is a C1 vocabulary. I'm seeing here. I am seeing it in another computer here, right? So I cannot show you both the computers, so that's why. So I'm giving you directly. I'm seeing there and I'm giving you. Okay. So all the 6 words I have used in one particular sentence. I told only 4 words, but maybe there are 1 or 2 other words also. So how to improve the quality? No need to speak too much. No need to speak too much. Okay. So now next step. So you can use these words in your own sentences. Come on. Take any one word and say one sentence. No need to use all the words in one sentence. No need to use all the words in one sentence. You take one word and one sentence. Now participation. So who is ready to participate? The first word is refer. You have to speak using the word refer. Yes. So one by one, you can just unmute and you can speak. Yeah. The power is given to you to unmute. You can unmute. Anyone can unmute and you can speak. Yeah, one after another. Yes, referral. The first word is referral. Number one word, referral. Refer or referral or refer, any word, and it's from original word is refer. You can say referral, you can say referred, you can say referring, anything is okay. Any tense, anything, everything is fine. Yeah, you can unmute and you can speak. After considering all the possible conditions, we are left with no other option but to refer to a cardiologist. So like this, any sentence, come on. Who wants to speak?
Yeah, can I try, please?
Yes, please.
Yeah, based on your test result or ultrasound scan result, I would like to refer you to a specialist.
Yeah. Yeah, very good, very good. Can you repeat your sentence?
Yeah, based of your ultrasound scan result, I would like to refer you to a specialist.
Very good, very good. Based on the results of the ultrasound or based on the ultrasound scanning results, I am referring to you to a specialist. That's very good. Next. Come on, actively participate. No? You can write and speak also, no problem. If you fear suddenly coming to the mic and speaking, you can write and then practice and speak in the meantime. Yes. Yeah, Joseph Stanley, Prem Gaikwad. Then only two boys.
Can I speak out?
Yeah. Yes, Manasa. Yes, very good. Come on.
As per your discharge instructions, you are going to place in rehabilitation referral services. Is that okay for you?
Yeah, that's very fine. That's a good sentence. Can you repeat?
Yeah, as per your discharge instructions, you are going to place in rehabilitation services. Is that okay for you?
Yeah, that's good. You are going to be placed. Very good. That's fine. A small correction. Yeah, next. Anybody else? Anybody else? Yeah, good. Different types of sentences are coming. Very good. Yeah. Waivo, who is this? Can you write your name? Yeah, next. Mira. Yes. You can just unmute and speak.
I have got some notes here with this referral letter, but it would be helpful if you could tell me in your own words the first symptoms you noticed.
Very good sentence. Can you repeat the sentence so that others can follow you a bit slower?
I have got some notes here with this referral letter, but it would be helpful if you could tell me in your own words the symptoms you first noticed.
Very good. Very good. That's very good sentence. Really, everyone can use this in your speaking session. Right. Anesthesia Kelechi. Yeah. Unmute and speak. You have the right to unmute and speak. Yeah, anybody can unmute and speak. Yeah, Prem Gaikwad. Prem Gaikwad is yet another powerful person. He has good experience. Yeah, you can speak. And others also. Everyone, nobody is less, nobody is more. Yeah. Today's session is a very valuable session. This is targeting, 400 plus minimum. You can even target 500, 450 above. Yes, anybody you can speak. Okay, right. Then we'll go for the second word. Second word. If nobody is going to open and speak, I will not force you to speak, okay? If nobody is going, then we are going to the second word, that is detrimental. The second one is detrimental. Okay, no problem. If somebody is not participating, it's not our problem, okay? You practice your own, nah? Those are going for the exams, participate. Try to practice. Okay, detrimental. Detrimental. The next word is detrimental. Come on. Yeah, you can write your sentences, and those who want to speak, just open your mic and speak. Yeah. You feel that, according to you, smoking is okay because you have been smoking for decades together, almost 3 decades. So you feel that there is no problem, but internally there is a lot of damage. You do not know this cigarette smoking is irrefutably detrimental for your health, is going to kill you from within, and only in the serious condition you will know the value of my words. Please, your health is our utmost priority, so don't undermine or underestimate the words which I'm telling you, because we care for your health. Prevention, at least now, would be better for you. Detrimental. Use the word detrimental. Yes, come on. So your focus is only to use one word, detrimental. Anybody, come on. Participate. This is going to be an awesome session. Unless and until you participate. Otherwise, what is the use? I'm not going to be the examinee. I am a teacher. So you are a student. You are going to do the exam. Come on.
Can I?
Yes, Manasa, very good. This is what I want. Not to say, can I? Just open your mic and start speaking. Others will follow the suit. That's all.
Yeah. If you use this drug overdoses for longer duration, it is going to be detrimental on your health.
Yeah, very good sentence, but I want to amend that sentence. Using this drug on a long-term basis is definitely detrimental. So instead of if you use, it will be directly using. Long-term use of this drug is detrimental. Finished. You understand now? Short and sweet.
Yeah.
Is that clear, Manasa?
Yes, sir.
You have said correctly. There is no problem with your sentence. Can you repeat your sentence?
Yeah. If you use this drug overdose constantly, it's going to be detrimental on your health.
That's 100% right. That's definitely a wonderful sentence. I've just improvised your sentence. Next. Come on, don't wait for anybody.
Hello, sir.
Yes, Suma Maria, get on.
Please you refrain the fatty foods in your daily meal. Otherwise, it will detrimental in your health.
Yeah, detrimental to your health. Detrimental to you. Can you repeat the sentence, please?
Please you refrain the fatty foods in daily meals. Otherwise, it will detrimental in your health.
Very good. Now I will improvise this sentence. Unless and until you reframe your dietary patterns, this food style will be detrimental to your health. So you can, your sentence is right. There are some small minor errors. There's no problem. Okay, I'm just improvising the sentence in a different style because many people will be listening to these audios. So then they can take these sentences, and you also can go to the audio. It's already on the YouTube. You can go there and you can definitely improve the quality of this sentence. Yeah. Next. I am using. Okay, fine.
Hello, sir.
Next. Who
Hello.
is this YO Y3?
Anastasia Kelechi.
What's the name?
Anastasia Kelechi.
Anastasia. Okay, Anastasia. Yeah, you can start.
Based on your medical condition, continuous smoking will definitely be detrimental to your health.
Wonderful. Can you write the sentence also? Well, repeat the sentence first.
Based on your medical condition, continuous smoking will definitely be detrimental to your health.
That's very nice. That's very nice. Whatever sentences
speak?
you are speaking, you can write in the chat box so that I
Yeah.
can improve those sentences and give you. Yeah, Amira
Can
Ali,
you hear
very
me?
good. Yeah, all of you, write down there. Yeah,
Can you
next.
hear me, sir?
Yes, Prem
Can you hear
Gaikwad,
me?
I welcome you. Very good.
Thank you. My sentence is physiotherapy is essential part after post surgery, or else you need to you will determine detrimental or it may cause of detrimental of joints.
Very good. Very good. So post surgery, once again, can you repeat the sentence, please?
Physiotherapy is essential after the surgery. Okay, physiotherapy is essential after the surgery, or else it may cause determination of your joints.
Okay.
Determination of your joint.
Yes. Post surgery physiotherapy sessions
Mhm.
are extremely important. Otherwise, detrimental consequences are inevitable. So I'm giving you A grade sentences. I'm giving you B+ grade sentences. Your sentence is okay. Your sentences are okay. I'm just changing in a little bit. Okay, that's why I'm asking you to repeat so that I can catch your essence. Right, very good. You have given a good point there. You started thinking, everyone. You started thinking. That's very good. Yeah, next. Write down your sentence there so that I can improve that sentence and I can give you. Yeah. Next. Yes, next. Who next? Now we'll move to the.
Sir?
Yeah, please. Who is that?
This is Joseph here.
Yeah, very good, Joseph. Welcome. Welcome.
Yeah, thank you, sir. Sir, socially, it is known that intake of high cholesterol diet is going to be detrimental to people's health.
That's awesome. Can you repeat?
Socially, it is known that intake of high cholesterol diet, it is going to be detrimental to the people's health.
Yeah. So I am modifying your sentence. Your sentence is
Yes.
correct. Your sentence is correct. It's apt. But I'm improvising the quality. I'm leveraging it to a higher
Yes.
stance from B to C. So once again, so here consumption of high cholesterol dietary regimen is undoubtedly detrimental for your regular health. So like that you can modify. That's good. It's a good sentence. Very good. People are started thinking we are going to improve the quality of the sentences. This is for the focus of the exam going students for 13th May and the 27th or something. Okay. Yeah. Next. Yes. Participate. Danya, Chaitra, Meera, then Pranita. All of you participate. Yeah. This is for you people, not just for me. Right. Come on. So the next third sentence, if nobody is moving on, next the third word is comply, compliance, comply. Number third is comply. I have used all these 6 words in one sentence. I want you to do at least one word in one sentence. Okay, fine. So because all of a sudden you cannot do those things. Come on. Yes, comply, compliance. Yes. Compliance. Comply, complied. Non-compliance. Use any form. No problem. Okay.
Yeah, a simple sentence.
Yes,
If you
please.
if you comply with my advice, you may get better soon.
Yes. If you comply with my advice, you will get well soon, you told. Okay. If you comply with my advice, you will get well soon. That's fine. That's what you told. So what I'm telling you is, if you comply with my advice, you and my, eliminate these 2 things. Eliminate these things. Compliance with the regulations or recommendations. Okay. Non-compliance. Non-compliance or compliance with the suggestions provided. Compliance with the provided suggestions will definitely enhance or speed up the recovery process. Non-compliance will be detrimental to your recovery. So like that. Yes, next, Gaikwad.
Yeah, kindly monitor medicine compliance.
Kindly monitor medication compliance, not medicine
Kindly
compliance.
monitor,
Medication
kindly
compliance.
monitor his or her medicine complex.
Okay, kindly monitor. That means you are requesting. There is no need to
Yeah.
request. There is no need to request. Kindly, please, kindly, please. No need.
Okay.
We are professionals. So let it be
Okay,
formal.
monitor.
So use passive voice. Medication compliance is required. Finished.
Okay.
Medication
Okay.
compliance is advised, suggested, required. That's it. Finished. Is that clear? Next.
Or else,
Yeah.
monitor. Okay, fine, fine.
Yes, yes. Next.
Hello.
Yes,
Hello?
please, Anastasia.
Okay. Compliance to medications will enhance excellent health.
Yes. Compliance to medication. You can make medication compliance. 2 words instead of 3 words. That's very good. That's very good. Next.
Sir, can I?
Yes, no need to ask. Just start up.
Yeah, the medical compliance shown by you since beginning has placed you at best recovery.
Very good. Can you repeat?
Medical compliance shown by you since beginning has placed you at best recovery.
Okay, that's good. That's good. Okay, that's really good. So, but medical compliance or medication compliance or medicine compliance, that you see which is collocation going fine. Mostly we use medication compliance, mostly. So that's the best form. So using medication compliance would add quality to that one. This is okay, but use medication compliance better. Yeah, next.
Sir, excellent
Yes.
compliance with the physiotherapy section. Along with the medication, you will shake off the illness.
Yeah, once again.
The excellent compliance with the physiotherapy section, along with the medication, you will shake off this illness.
Very good. But you have said a section. It's not section. It is session. SESSION. Session, not section. Okay.
Okay. Okay.
Yes. So next. Anybody else? Yeah. Active participants, please. Yeah. Meera Manoj.
Whether you comply with the medication or to be reluctant to take medicines recommended by the doctor. The suggestions are mine. Implementing the decision is absolutely yours, right? We cannot compel you.
You very good. Excellent. Excellent. I want you to repeat the sentence and others just to go through this point. It's very nice sentence. Yeah.
Whether you comply with the medication or to be reluctant to take the medicines recommended by the doctor. Suggestions are mine. Implementing the decision is absolutely yours, right? We cannot compel you.
Yes, oh, very good, very good. That's a wonderful sentence. So I am concising it a little bit. Acceptance or rejection to medication acceptance or rejection of suggestions to medication compliance is your right. It's your decision. Suggestions are mine, decision is yours. So that's a very good sentence. You can modify and you can alter however you want. This presentation is very good because you cannot compel somebody. That's very good. Okay. I cannot force you, but you can reason the priority and take your own steps. That's very good sentence. I really like that sentence. Yeah. Next. Next, please. Yeah. Sabah Nazir. Sabah Nazir. Pranita Pamarti, Prem Gaikwad. Okay, you have done it. Right. Next. The next word is yeah, undeniably. Undeniably. This is C2 word. Undeniably. Yes. Undeniably.
Hello?
Undoubtedly, irrefutably. Yeah. Anastasia Kelechi. Yeah.
Your concerns are undeniable.
Yes. Your concerns are reasonable. Many says. Okay. Yes, that's very fine. Your concerns are undeniable. Okay. If I were in your place, I would have reacted in the similar fashion. But as a nurse, I'm going to give you some relevant information. Based on that one, you can decide. So that's what it is. Yeah. Next. Undeniably. Undeniable, undeniably, deny. Yes, next. Once you finish your speaking, you can mute back. All of you. Yeah. Next. Undeniably.
Yeah, sir.
Yes, Manasa.
The right to say no for the treatment is your right. It's undeniable. But I would like to suggest you to go with treatment. That will be beneficial to you.
Very good. Very good. Yeah. What all you are saying, just all of you after telling, you can just type them for others too. For the others too. For the others to go through your sentences. They will benefit for them also. So you can just type the words also there so that I can also take them and improve the sentences and give them to you. Yeah. Yes, please. Next. Unmute and speak.
Hi, sir.
Yes, Sabah Nazir, very good.
Yes, sir. Your meeting is undeniably important, but your appointment with the doctor is the most priority.
Is of utmost priority is better. Utmost priority. Is of most priority is of also fine. Utmost. Where are you from, Sabah? Are you from North India?
Sir, I am from Pakistan.
You are from Pakistan. Okay, Pakistan
Yes,
is almost North India. Okay, fine. Right.
Yes, sir.
So it's North. Yeah. Punjab and Punjab, like, yeah. So the sound, the accent, I felt like. Okay, fine. That's very good. Next. Yeah. Next. Blessing Erseba, Chaitra, come on, participate. Participate. This is a place to participate. Today we are dealing with vocabulary, a very powerful session. Suma Maria, Prem Gaikwad, Stanley. Use these 10 words in your speaking and you will get C grade. No doubt regarding that one. Because the sentence itself will jump up to a higher power.
Yeah, sir, what about he undeniably shares some of his social history?
Yeah, can you repeat?
He undeniably shares some of his social history.
I could not catch you probably. Shares. Okay. He undeniably shares some of his. You have written it already. Okay, fine. He undeniably shares some of his social history. Yeah, that's fine. That sentence is correct. Grammatically, it's correct. Grammatically, it's correct. No problem with that. Yeah, next. Yeah, all of you open up and just speak.
Hello, sir.
Yes, Mira.
Mr. Lincoln, it's an undeniable fact that there are some risks involved in immunization, but it can easily treated and overcome. Ultimately, the benefits of vaccination far outweigh the negative effect.
Yeah, very good. Your sentence very good, but there are one or two instances I have noticed. Can you repeat your sentence?
Mr. Lincoln, it's an undeniable fact that there are some risks involved in immunization.
Yeah, there are some risks. This is number one. I just could not recall immediately. I have some short-term memory problems. When I focus on the other things, I forget on the earlier things. So there are some risks involved, not some risk. There is some risk or there are some risks. You said there are some risks. So there are some risks involved. Risks, sa is important. Okay, I don't know whether you have pronounced sa or not. So I don't know whether you have noted that one. So there are some risks or there is some risk. Both are okay. There is some risk or there are some risks. First one is uncountable. There is some risk, uncountable. There is a risk is countable singular. There are some risks is countable plural. There is some risk is uncountable. So all are correct. All the three forms are correct. And continue with that. Continue.
But it can easily treated and overcome.
But it can be easily treated. It can be easily treated. These two I noticed. So on the spot, I pointed 1, 2 because I can't recall. So I asked you to repeat the sentence. Okay. But it can be easily treated. Did you get the point?
Yes, sir.
So I think you corrected the points now. Fine. Very good. Yeah, continue. It can be easily treated.
It can be easily treated and overcome. Ultimately, the benefits of vaccination far outweigh the negative.
That's an awesome sentence. But that's an awesome sentence. Yeah, you can write the sentence there so that others also can take your copy your sentences. So very good. You're writing very good sentences. I appreciate your talent in creating good sentences. That's really very nice. Yeah, Anastasia. Yeah. Next. Yes, please. Next. Anybody can speak. Okay. If nobody is going to speak, we are going to move to the next point. Comply over. Then next one is fourth one. Undeniably is over. Complication. Complication. In the event of, in case any complication arises. So complication or complications or complicate or complicated or whatever you want to say, you can say. Okay.
In case any complication arises post-surgery, the team is not responsible for that. Is that okay for you to proceed for the surgery?
Very good, very good. Can you repeat?
If any complication arises post-surgery, the team is not responsible. Is that okay with you to proceed for the surgery?
The team is not responsible for any post-surgery complications. I just altered that one, right?
Okay.
I concised it. So you said if
Yeah,
there
so-
are any post-surgery complications,
Yes.
the team is not responsible. I made it. If they,
Yeah.
instead of all these things, the team is not responsible for any post-surgery complications. Yeah,
Complication,
that's the
sir.
sentence. Yeah, next, yeah, Prem
Okay.
Gaikwad, come on.
Yeah, complication may occur if you don't take insulin regularly.
Yes, try to use such words in the plural. Complications may occur. Yeah, repeat the sentence.
Complication may occur if you don't take injection insulin on a regular basis.
Yes, yeah. Intermittent compliance with the insulin injections result in complications, in unavoidable complications. So like that, you can say, your sentence is absolutely right. Your sentence is absolutely right. There is no doubt with your sentence. I'm just giving you some additional, polishing. Crude diamond is polished. Yeah. Next. Next. Come on. I don't need to be behind you all.
Your concerns are undeniable, but complication will be reduced after the completion of your antibiotic full course.
Oh, very good, very good, very good, Summa. Can you repeat the sentence?
Your concerns are undeniable. The complications will be reduced after the completion of antibiotic full course.
Very good, very good. That's good. Next, yeah, Meera.
It's nothing to get alarmed about current condition, and the risk of complication is very low indeed.
Yeah, one thing here. You have one mistake here. Can you repeat the sentence?
It's nothing to get alarmed. The risk of complication is very low indeed.
Yeah, the sentence is right. The sentence is right. But in the beginning, there was something slight difference. So I just noticed that one. Yeah, there is first sentence. Can you repeat the first sentence?
First time I said alarm only, sir. I forgot.
Yeah. Can you repeat the sentence?
It's nothing to get alarmed. The risk of complication is very low indeed.
Okay, there is nothing to be alarmed about is the right time. There is nothing to be alarmed about. That's better. Okay, not get alarmed, but be alarmed is right. Not get alarmed, be alarmed is right. There is nothing to be alarmed about. So you missed that about in the first part. Otherwise, it was right. Yeah. Next.
Hello?
Yes, dear.
You follow all suggestions. The chances of having complications are minimal.
Yeah, that's very good. That's very good. Yeah, next. Come on, all of you participate. We are not silent here. All of you try to participate. All of you participate. After participation, you can mute your mic. Next. So the next one is arise. Rise. I'm going to speed up. Because new people are coming. So if nobody is participating, I'll call some students who can participate. So I'm inviting some other students. So come on, get ready. Yeah. So arise. A-R-I-S-E.
Long-term complications may arise if you don't go for preliminary screening.
Very good. Yeah. So, yeah, some sentence. Current, some, yeah. I was thinking, what was that word? What was that word? Yes, sir. Current, the current. Somebody told that word, current. I was thinking, I caught that word, but I could not recall. Someone said current. So that I don't remember exactly who told current, but current, whenever you use the word current, there should be the current condition, the current reasons, the current problem, the current situation, the previous, the current, the future, the present, the ongoing. So anything related to time, there should be the definite article, the. There should be a definite article, the, compulsory. Yes. Come on, next. Come on, I'm doing multitasking here. I cannot follow you up everything. Yes. Arise. The next word, seventh word. Seventh word is scrutiny. You use it in writing or you use it in speaking. Scrutiny. The doctor has scrutinized all the possible reasons and ultimately came to the conclusion that there is no other option left other than prescribing insulin injections. Scrutiny. After scrutinizing, scrutiny means careful observation. Yeah, come on, Gaikwad.
You need to scrutinize the documentation before you take the over.
Very good, very good. That's really good. Yeah, next.
Careful scrutinization is important.
Assistant so that I can get all your words typed, but I did not think about it. Otherwise, I would have taken artificial intelligence. Next time onwards, when we do these sessions, I'll give all these things in written form. They will come, the entire lecture. Yeah, then we don't need to repeat these sentences two times. One time is enough. Yes, next. Who was that? Who opened the mic and yeah, start. Yes, Mansa. Yes, come on, Mansa.
Careful scrutinization of your reports is important before deciding on your surgery.
Once again, what is that?
Careful scrutinization of your report is mandatory before deciding on surgery.
Scrutinization. Let me check the word scrutinization. Scrutiny is a noun itself, but the scrutinization. Scrutinize is there, but the scrutinization. Scrutiny is itself careful scrutiny. That's enough. Okay. Scrutiny. Right. So scrutinization is not there. It is C2 vocabulary. Scrutiny is C2 vocabulary. Yeah.
Okay.
Yeah. Next, Mira.
Excuse me. Just I would like to use arise in a sentence. Can I?
Okay. Yeah. Okay. Carry on. Your request is accepted.
Okay, he died of complications arising from heart surgery.
Yeah, that's very good. We appreciate participants. We always welcome. No problem.
Thank you.
Okay. Yeah. Yeah. Sorry, Mira. Yeah. Next, come on, Mira.
Your doctor will scrutinize the MRI report very closely and trying to devise the treatment plan.
Very good. Very good. So before you can use the word prior, Prior. So that also is a good word, prior. Prior is C1 vocabulary. Prior is C1 vocabulary. Eighth one, prior means before. Prior is C1 vocabulary. Prior is C1 vocabulary. Yeah. Next, scrutiny. Can you repeat the sentence, Meera?
Your doctor will scrutinize the MRI reports closely and trying to devise the treatment plan.
And trying to, did you say and trying to?
Devise the treatment plan.
No. Did you say trying to?
Yes, sir.
Okay, so you have to say your doctor will, you said in the beginning, so will scrutinize and will try to, not trying to, try to. Okay, already will is there.
Yes, sir.
So your doctor will scrutinize and try to. So this is a future tense. Trying to will not come, will try to. Okay,
Yes, sir.
try to devise, not trying to devise. It's try to devise, will try to devise, future tense. This will is for both the parts. Yeah, that's very good sentence. You can write that sentence and post them so that I can give you clarification there. Okay, next.
After the thorough scrutinize the blood results, only doctor will decide to surgery date.
Very good, very good. Can you repeat the sentence?
After the thorough scrutinizing the blood results, the doctor will decide to surgery date.
Yes, very good, very good. Next. Suma. Yeah, next. Okay, the next word is prior. Prior, P-R-I-O-R, prior, C1 vocabulary. Learn 100 words enough for you. Prior, P-R-I-O-R, prior. Yeah, Manasa.
Prior consultation is important to meet Mr. John.
Yeah, very good. Simple sentence. Prior consultation is needed or is required to meet. Yeah, fine. Next.
We'll give priority to you. You just need to have a seat in the waiting area.
Can you tell it little loudly, please?
We'll give the priority as soon as doctors get free. You just need to sit in the waiting area.
Okay. Yeah, very good. Very good. Yeah, next.
Sir, do you have prior history of same problem?
Yes, very good. When I am asking somebody to repeat the sentence, that means the sentence is very excellent. Okay, remember that one. When I am asking somebody to repeat the sentence, that is a mega sentence. When I am asking somebody to repeat the sentence, that is a complex or compound sentence.
Hello.
When I say somebody to repeat the sentence, that is a double compound sentence. When I ask somebody to repeat the sentence, that may be a simple sentence along with a complex sentence. It's a mega sentence, complex or compound sentence. So try to use those sentences, try to learn those sentences. Joining 2 or 3 sentences together is a mega sentence. That's what I'm telling you. Right.
Hello.
Next. Yes, please, Anastasia.
Prior to her medication, excessive vomiting was noticed.
Yeah, very good. Very good. Yeah. Come on, open your mics and speak on.
Sir, prior to the surgery.
P-R-I-O-R, prior, yeah.
Yeah, prior to the surgery, your consent is mandatory.
Yes, very good. Very good. Yeah. Yeah. Next. Yeah, Blessing.
Prior to application of CAS, physical examination was done.
Yeah. That's good. That's good. Next. Now the next word is render. R-E-N-D-E-R, render. Render means to cause someone or something to be in a particular state. Render, to cause someone or something to be in a particular state. Okay. Render means resulted in or cause someone or something to be in a particular state. Accidented, rendered him. Okay. So to be in a particular state.
The nurse, yeah. The nurse is someone who renders her services for patient care.
Very good. Very good. Yeah, next. His rudeness rendered me speechless. Okay. New technology has rendered my old computer obsolete. These are some examples. Okay. His reluctance rendered me speechless. His reluctance to medication compliance, okay, rendered me speechless. His reluctance, okay, his adamant, okay, he's not ready to listen, his reluctance. So rendered means to cause someone or something to be in a particular state. So his disobedience rendered me speechless. He's not obeying. So what I can do? I just looked at him like that. His disobedience rendered me speechless. Whatever I say, he's not listening. So I could not do anything. I just shut my mouth. That's it. So that's the meaning of rendered. Yeah. So C2 vocabulary. All these words, try to use them. I'll give you different. If you write, I'll correct it. I can give you. Next one. Yeah.
Depression can render a person helpless.
Reluctant to exercise regimen rendered him immobile.
Yes. Next one is word. Yeah, come on. Anybody else is there?
Hello?
Yes, Anastasia.
Reluctant to regular exercises rendered him immobile.
Yeah. So next word is coincide. C2 vocabulary. Coincide. Coincide means happen together. To happen at or near the same time. It's coincidence. Coincidence. Coincide means happen together. Two incidents happening together. Yes. Coincide. Coincidence. To happen at or near the same time. Yeah.
Your consultations with neurologist and cardiologist are coincide. What is your priority now?
Yeah. So your consultants with the neurologist coincides with that of the neurologist. So what is your priority? Yeah, that's fine. Yeah. Your operation coincided with an emergency. So the priority was the emergency. So your condition is not very complicated. So can you please wait for some more time? Yes. So coincide means happen together. Yeah, come on, next. I'm giving you many words. This is for the exam going students. I'm going to give 100 words also. If you don't participate, I'll move on. Okay. Coincide. At least somebody open and speak. Nah? If we can't, 2 or 3 people can't speak these words. That is the reason why we are not getting good marks. I'm giving you a chance to speak on these words. Try, nah?
If the rashes had coincided with the shortness of breath, and a detrimental effect would be anticipated.
Yes, that's very fine. It's not breathe, it's breath. If there is last E is there, it's breathe. Otherwise, it is breath. Breath, breathe. Breath is noun, breathe is verb. Okay?
Okay, sir.
Yeah. Can you repeat the sentence?
If the Rasha's heart coincided with shortness of breath, a detrimental effect would be anticipated.
Yeah. Very good. That's a good sentence. That's a good sentence. Next. Next. Anybody? Next one is medium. Medium. Yeah. Medium. Medium is B1. Media. Medium. Media. Yeah, B2. Okay, that's not needed. We are only focusing on C1 and C2. Yeah, anybody else? Any word? No problem. Yeah. Next one is undoubtedly. Undoubtedly. Let me check the value of this word. Undoubtedly. Undoubtedly is B2. Undoubtedly, instead of, if you cannot remember the word undeniably, you can use the word undoubtedly. Okay, we don't want to use that word now because it's not that important. It's not C1, C2. So next one is irrefutable. Next one is irrefutable. 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 An irrefutable argument. So refute. Refutable. Refutable. Refute. Refute. It is a powerful word, but they did not give that a value to this one. Okay, refute is a formal word. So irrefutable. Irrefutable. Instead of undeniable, you can use this word. Irrefutable. Yeah. Irrefutable. The expressed concerns are undeniably irrefutable. Okay. We cannot say no. Okay. The expressed concerns are irrefutable. Okay. Are irrefutable. Instead of undeniable, we can say irrefutable. That is also right. So if anybody wants to say a sentence using irrefutable, his arguments are irrefutable. Your rights are irrefutable or undeniable. I want to die with dignity. Yeah, your right is irrefutable. Your right is undeniable. Your right is non-negotiable. Your right is undoubtedly accepted. You can talk in different ways. So, refute.
Sir.
Yes, please. Come on, come on.
You cannot irrefutable. You cannot irrefutable asepsis.
No,
technique.
irrefutable is already negative.
Huh.
Irrefutable is already negative, so you cannot use not with that one.
Achha, okay.
Not and irrefutable becomes refutable. They cross
Mm-hmm.
themselves. So it will become positive. Yeah, you can correct your sentence, please. Yeah, come on. Yes, please. Then next one is past time. Anybody, come on. It's okay. We learn. Sorry.
Irrefutable asepsis technique in Operation Theatre.
Yes. That's fine. That's fine. Yeah, repeat the sentence, please.
irrefutable asepsis technique in Operation Theatre.
Yeah, don't be confused. It's okay. It's okay. No problem. Feel free. Otherwise, you write in a paper and you can speak. No problem. Okay. I know you have the correct sentence. You have the good idea. I know you are experienced person. Don't worry. Just feel free. No problem. I'm there to help you. Yeah.
The doctor has been stopped providing care only after obtaining irrefutable consent from the patient.
The doctor has?
The doctor has been stopped providing care.
The doctor
only
has stopped providing or has been stopped? The
Has
doctor has
been
been stopped or?
Yes.
The doctor has stopped them. Somebody stopped the doctor or doctor stopped something?
Doctor only stopped. It's because
then
of
you say,
Lama.
don't say doctor has been stopped. Doctor has stopped. Okay.
Okay. The doctor,
The doctor has stopped. Yeah,
providing
come on,
care.
continue.
The doctor has stopped providing care only after obtaining irrefutable consent from the patient.
Yes, that's awesome. Now the sentence is correct. Yeah, next. All
Hello?
these sentences before speaking, you can write in your notebook so that afterwards you can send it to me, then I can get it typed and afterwards I can improve the quality of the sentences and I can give you.
Hello?
Yes, dear.
Self-injection is irrefutable because that was the only option left.
That was the only option left. That's wonderful explanation. That's very good. Yes, next. Next word is pastime. Pastime. P-A-S-T-I-M-E. Pastime. Pastime means an activity that is done for enjoyment. Many people say, how will you go into... Yesterday I have seen one, I have gone through one role play. In this sense, you need something to do, some entertainment. Otherwise it will be boredom for you. So you can bring some, television or something like computer or something like that they were telling. So that is pastime. This is number 12. Number 12. Pastime is C2 vocabulary. What is your favorite pastime? Is it reading books or watching television or playing some board games, indoor games? You can tell me so that, because you know you are going to spend full for 1 week, you are going to spend here. Maybe you will be bored with all these things. So if you can pursue your pastime activities like reading books or watching television, then that will kill your time and you will not be bored. So pastime, P-A-S-T-I-M-E, pastime means habit. Yeah, please. Yeah, come on, pastime. My favorite pastime is reading books. So whenever I am feeling alone, okay, so you can say, you are getting panic attacks. Okay, don't worry. At that particular time when you're reading for hours together, of course.
Observed that.
Yeah, carry on.
Sir, can I?
Yeah, carry on.
The psychiatrist has observed that playing video games is pastime, which is addicted.
Yes.
Which is going to be addiction of him or addicted to him.
Yes. Involving yourself in involving yourself in constructive pastimes can pave the way for de-addiction to drugs. So de-addiction to drugs is destructive. Your habit is not good. taking drugs on a regular basis. So, rerouting or diverting your mind towards involvement in favorite pastimes would undeniably release you from taking drugs or de-addiction, help you in de-addiction, like that one you can say. Yes. Irrefutable means undeniable, means no, you cannot say no. Irrefute, refute means saying, refute means negation, means saying no. Irrefutable means no one can say no. Yeah, see, for example, the class which I am giving you, no one can say no, because this is a different, this is a different level of lecture. This is C1. This is what Cambridge University wants. Okay, I have already shown you Cambridge University CEFR levels. You go and see my other lectures, you will know CEFR, or just type a CEFR and OET, then you will know what is the value of the lecture which I am giving you today. Yeah. So pastime. Anybody?
Yeah.
Anybody?
She told me her pastime reading book, although I tried to persuade her to walk at least 30 minutes a day.
Very good. That's really very good. Yeah, next. Yeah, the next word is relentlessly. Relentlessly. Relentlessly is a C2 vocabulary. Number 13. Incessantly, that is also the same meaning. Relentlessly. This is C2 vocabulary. Okay. Then next one. Yeah, anybody can use this word. Come on. The same meaning is also incessantly, not ceasing. Relentless means, okay, incessant. Incessantly. That is also the same meaning. Unceasingly. Incessant. Yeah, never stopping. That's the meaning of this word is incessantly. Okay, unceasing. Unceasing. Instantly, no, incessantly. Farid, you are confusing me. Okay, unceasing. Unceasing means continuing and unlikely to stop or become less. Same meaning. All these three words are same meaning. I just gave you for reference. Okay, cease. The opposition of cessation. Cease. Cease is B2. Cessation. Cessation is a different level. Yeah. So give some words.
Hello?
Yes, please. Yeah, I have already told you, Farid, that irrefutable means, okay, you cannot say no. Then again and again, you are asking the same thing. Yeah. Yes, continue, Anastasia.
Complying relentlessly will greatly improve your health.
Yeah, relentless compliance. Okay, fine. That also is okay. Yeah, that's good. Next. Yeah, next.
She was attended physiotherapy sessions for her resumption of sport activities.
Yeah, can you say it a little loudly, please?
Okay, sir. She was attended physiotherapy sessions relentlessly for her resumption of sport activities.
Yes, that's very good. Yes, that's very good. I want you to repeat this sentence because I will concise it, if you don't mind.
Okay, sir, I will repeat. She was attended physiotherapy sessions.
She has attended physiotherapy sessions. Not she was attended, she has attended. Physiotherapy sessions were attended, that is different. So she has attended physiotherapy sessions.
Yes, relentlessly for her resumption of sport activities.
Yes, relentless attendance for physiotherapy sessions resulted in dash. No need she like that. Okay.
Can you tell one more, sir?
Relentless attendance with the physiotherapy sessions resulted in, and the continuation sentence you can add there. So after end, what is coming? That one. Okay.
Okay, sir. Thank you.
Yeah, that's good. That's good. Yeah. Next, relentlessly. Then next one is cessation. 14th one is okay. Cessation, ceasing, unceasing. Opposite is cessation, means stopping. 14 is cessation. Cessation. Cessation.
Smoking smoking cessation will help you to improve the condition.
Yeah.
Or smoking cessation helps to improve the condition.
Yeah. Smoking cessation is advised. Cessation of smoking is recommended, or smoking cessation is recommended. In addition to smoking cessation, reduction of alcohol consumption would be undeniably beneficial for ensuring a speedy recovery. So this is how you can, can play with the words. Yeah, that was a good sentence. Yeah, next.
You need to educate him or her to suggestion of drugs.
Yeah, that's very good. That's very good. Next. Next one is, yeah, 1 second. Yeah.
In the event of high cholesterol, cessation of dairy products has been recommended.
Good, very good. Yeah. So, yeah, next.
Advice on lifestyle modifications, including smoking cessations and regular exercise was given.
Yeah, that's good. That's good. Yeah, next. Anybody else? Yeah, next word is infinite. Infinite. There are infinite possibilities to recover from this disastrous conditions, provided smoking cessation, in addition to reduction of alcohol consumption, okay. So modify these sentences like this. So infinite, there are infinite possibilities to recover absolutely from this disastrous situation or circumstances. However, smoking cessation, not only smoking cessation, but also minimizing alcohol consumption are recommended. So like this. Yes. So infinite. Infinite. There are infinite possibilities. There are infinite programs. There are infinite measures that you can implement. Okay, means a number of, several, various, multiple, numerous, uncountable. Okay. The number of words. Infinite means cannot count. So that is another word. Yeah, next one is inevitable.
She has patience when she is dealing with her medications.
Yes, can you repeat, please?
She has inevitable patience when she is dealing with her medication.
Yeah, can you please type the sentence?
Okay.
It's good sentence, but I want to check it once again. I want to confirm. Yeah.
Okay.
There are infinite behavior that can enhance good health. Is that what? No, that is not your sentence. Yeah, you can just
No,
type this
no.
so that I can just follow it. Yeah, next. There are infinite reasons for your present condition. Yeah. Next one is inevitable.
I wrote it, sir.
Yeah. Inevitable is C1. Cancer is inevitable if alcohol consumption is not stopped. Cancer is inevitable if you do not stop alcohol consumption. You is missing and do not. Oh, that is Farid's sentence. Sorry, Amira. She has infinite patience. That's good sentence. She has infinite patience when she is dealing with her medications. Yeah, that's fine. That's fine. That's a good sentence.
Okay,
Cancer
thank
is
you.
inevitable if you do not stop alcohol consumption. Yeah, next. Anybody else? Anybody else? You try to use 20 words in your OET. 10 in the first, 10 in the second also, it's okay. But if you use 20 C1 and 20 C2 vocabulary, no one can stop you from getting C grade. Getting C grade is inevitable. That means nothing can stop you. It's definite. It's definitely, it's sure. It's 100% guaranteed. That's it. Use 20 plus 20, C1 and C2 words respectively in each speaking role play, and A grade is inevitable, means sure to happen, definite. So use the word inevitable. Yeah, next. Inevitable is the one word.
Hello?
Yes, please, Anastasia.
Complication is inevitable if you do not follow all the instructions.
Yeah, that's very good. Yeah. Next one is the word contradiction. Sorry. Contradiction. Contradiction. This is C2 vocabulary. Contradiction. The fact of something being the complete opposite of something else or very different from something else, so that one of them must be wrong. Contradiction. Contradiction. what you tell regarding the signs and symptoms are totally contradicting with your present condition. You say you don't smoke, you say you don't drink, you say you don't have any negative habits like drug addiction or not, but your condition has worsened, and this totally contradicts with your present condition. Okay.
The ideas expressed by two scientists are contradicted with each other.
Yeah, Nuziba, where are you from?
I'm from Coimbatore.
You're from Coimbatore, Tamil. Okay, Tamil, very good. Yeah. So, first time you are attending the session, how do you feel the classes? Are they useful for you? What do you
Yes,
think?
sir.
Because
Yes,
nobody
sir.
teaches these things. Why this Simon is mad is teaching all these things? Many people don't attend these sessions because they don't think that these are useful. Nobody teaches, so this is nonsense. They think. Why are you staying here on this platform and learning so many things? What's the benefit you get from this? What's the outcome?
And it is actually bring lot of initiation in making sentences, sir, with a single word.
Yeah, you're focusing on the word and words are automatically coming. That's what it is, right?
Yes, sir.
What you do when you want to give injection to a child, I'm taking this technique, you know. I saw some Facebook or YouTube, some video or short video where the doctor, you know, he takes some pencil or that one injection needle and he turns it backside and he pokes here, he makes the child to laugh and suddenly pokes the injection, and by the time he removes the injection, he's still laughing, and afterwards he feels the pain, but the injection is done. So like that I'm doing it. You don't know what you are doing. That's the thing here. Huh? Yes. So next, the next word, contradiction. Yeah, contradiction. Yes, others, come on, participate. Don't make me, you know, lazy.
Hello.
Yes.
Consumption of alcohol can contradict the effectiveness of the medication.
Yes, absolutely. Consumption of alcohol contradicts with medication.
The effectiveness.
Sentence grammatically it is correct, but it doesn't make a little, it's deviating a little in sense formation. So, how you can modify this sentence? Can you repeat the sentence?
Consumption of alcohol can contradict the effectiveness of the medication.
Yeah, now that's fine. That's fine. That's absolutely fine. Wonderfully made sentence. Very good. Yeah, effectiveness here. That's very good. Yeah. That's absolutely fine. That's a wonderful sentence. I appreciate your sentence. Yeah. Next. Next one is the devastating. Devastating. Devastating means harmful, hazardous. Devastating is C2 vocabulary. So 15th one. Devastating. Detrimental, same meaning. Devastating. Okay, C2 vocabulary. Devastating. Consumption of alcohol can result in a devastating impact. Devastating means causing harm, causing a lot of harm, causing a lot of damage or destruction. Devastating means beyond reason, harm beyond reason. Smoking is devastating for lungs. Yeah. Smoking is devastating for lungs. No, smoking has a devastating impact on lungs. Not devastating for lungs. Okay, has a devastating impact on lungs. Okay.
Chemical fertilizer causes devastating effect on land as well as health.
Yes, that's fine. That's fine. Yeah, next. Very good. These are very powerful students. Some students are not participating. They are playing hide and seek with me. Don't do it, my dear. I am a winner in hide and seek. Okay. I will find out from every nook and corner, and I can identify. Even when I was a child, I was very keen on that one. So don't think that I can, okay, see you, not see you. Okay. Pranita Pamarti. Yeah. All of you participate. This is very special session. I told you already. Yes. Yeah, these only words will come in the reading and listening also. Yeah, next. This Farid will kill me. What do you mean by my teaching has a devastating on your learning? I don't understand what you're telling. Huh? So my teaching is spoiling your learning. Huh? Okay, anesthesia, come on. You have told totally. Huh?
Non-compliance to insulin injection can be devastating to your health.
Yes, can be devastating to your health or can have a devastating impact on your health. Both are right. Yeah, that's very
Peter,
good. Yeah.
sorry,
Next,
sorry
next,
to
next. Yeah,
sorry
Farid,
to-
don't kill me, okay, with your words
No,
and
no,
your
no, no,
sentence.
sorry.
I'm joking, I'm joking. I know. Yeah.
You are my favorite teacher, to be honest, Peter. Really, really. I love to watch your videos and the way you are working with us.
Okay. Let's continue. Come on. Come to the
Okay, okay.
sentence. Tell some sentence. Let's not deviate from the topic. Deviate. So another word has come. Deviate. Let me see what is this word. Deviate. Deviate.
Yeah, sir, is devastating. Can I say a sentence?
Yes, please.
Yeah, we are deeply saddened by devastating tragedy. This tragedy.
Yes. Very
I
good.
will write. Yeah.
Yeah, you can write, please. Yeah, next.
Hello, sir.
Yes, please, carry on.
The mother was devastated about the news for the surgery being carried out for the son.
Yes, that's fine. That's fine. Then next one is the word. We are saddened by this devastating tragedy. Very good sentence. Amira, very good sentence. Yeah, I could not catch it that time. Yeah. Next word is number 16. These words you use in your speaking. Casualty. Casualty. Yes, this is C2 vocabulary. Casualty means a person injured or killed in a serious accident or war. So there were some casualties and we had to attend on an emergency basis. That is the reason why your operation has been delayed, because there are more serious concerns that are to be attended. Casualty, a person injured or killed in a serious accident or war. So injury. So people coming with injuries. So that is called casualties. Okay. Casualty word. Okay. Come on. Yes, only the regular students can attend this session, others cannot. So we need not invite others also. Yes. Yeah, Nuziba. Yes, come on, next. I'm waiting next. Who? Casualty.
Sir, can I go on?
Yes.
We were short-staffed because of the casualty at the emergency room yesterday night.
Yeah, that's absolutely fine. Yeah, next. Next one is number 18, 17. Yeah, very good. Number 17. Number 17 is a definitive diagnosis. So C2 vocabulary, definitive. Not able to be changed or improved. So that means it's 100% correct. Means perfect diagnosis. Definitive, not able to be changed or improved. Definitive. The doctor has provided the definitive diagnosis, and therefore there is an immediate requirement to modify your dietary regimen in addition to exercise on a daily basis. Yeah. Yes, come on, next. Yeah, come on. We'll see at least 25 words today. Tomorrow morning.
Coronary artery.
Yes, Nusiba, come on.
Coronary artery bypass surgery is a definitive treatment for multiple blocks in the coronary artery.
Yeah, that's good. That's good. Next. Next. Rejection. Rejection is C2 vocabulary. Number 18. Number 18, rejection. C2 vocabulary. Rejection. Rejection of nutritious diet. Rejection of nutritious diet. Okay. Will be disastrous. Rejection. Yeah. For example, my father is 80 years old, and if he does not accept to take this dialysis treatment, what are the conditions? What problems may happen? The son is asking the nurse. Okay, he came to find about the dialysis treatment, the complications and after effects. And the nurse says, what? Suppose, in case, yeah, my father is 80 years old. If he denies, if he rejects, okay, if he doesn't want to take this dialysis treatment, then what happens? 3 times dialysis, he doesn't want to take. Then what are the complications or what are the effects that he has to encounter? So now, rejection of dialysis. So you can continue now. Okay. You can continue your sentence. Rejection. Anything, any sentence, anywhere you can use this one.
The family member rejected blood transfusion because they are Jehovah's Witness.
What, Farid, the rejection of the treatment is irrefutable. You can, okay, yeah. Rejection of the treatment is irrefutable. Okay, that means you cannot say no. You have to say no when he rejects the treatment. How can you say it is irrefutable? Huh? You're totally contradicting. Yes, please.
Constant rejection by the peer groups makes Mr. Jacobs acceptable to depression.
Yes. Contact rejection of the patient's requests will ultimately lead him to depression. Yeah, that's fine. Very good.
Hello?
Yes.
Constant rejection to medications is detrimental to the health.
Yeah, very good. Next.
Yeah, the patient's body rejected the donor kidney after having a successful kidney transplant operation successfully.
Yes. Can you repeat the sentence?
Again, the patient's body reject the donor kidney after having successful transplant operation.
That's a very wonderful sentence, but I would want you to type the sentence so that I can get a clear picture, because there were breaks in your, when you're speaking, I could not follow because there is some distraction here and there. Don't worry, no problem. I think sentence is good, so it deserves attention. So please type it. Yeah. Next. That's a really good participation. Very good. Here is the last 12 dozens. Come on.
Treatment rejection by the patient is undeniable.
Can you repeat, please?
Treatment rejection by the patient is undeniable.
Treatment rejection by the patient is undeniable. Yeah, that's fine. That's fine. You cannot say no if the patient denies the treatment. Yeah, that's fine. Yes. Next. Good participation. I like it. Then the next sentence, next word is there are, yeah. Yes. Medication. The next word is medication. And what is the power of this medication? You don't know these powers actually. Okay, you use medicine like that. Medication. Medication is C2 vocabulary.
Sir, can you assess my
yeah,
sentence?
one second.
Please. Okay.
This is 19. 19 is medication. Medication is C2 vocabulary. If I say C2 vocabulary, must use words. Medication, yeah. The patient's body rejected the donor's kidney, apostrophe S. That is what I wanted to say, because I was not very clear. Donor's, D-O-N-O-R, apostrophe S. Donor's kidney after having a successful kidney transplant operation. Yeah, fine. That's correct. Absolutely right. 99%, not 1% missing. That is donors, D-O-N-O-R apostrophe S. So medications. Medication. Yeah. One by one wickets are dropping, no problem. So we'll take 5 more words and we will stop, no problem. Medication is C2 vocabulary. The next one is systematic. Systematic is C2 vocabulary. So medication, anybody can speak on medication. Next one, number 20 is systematic.
On admission, he complained about pain on multiple sites for which medication such as paracetamol and so were prescribed.
Yeah. Can you repeat the first part?
On admission, he complained about multiple pain on multiple sites for which medications were prescribed.
Yeah, I think it's better you type that one for me. You can type that one for me so that I can see. I did not get your sentence is, I can say 90% correct. Some small thing is missing somewhere. I just want to see if you can type the sentence, then I can tell you. Yeah. Next. Next. So systematic is also systematic life. Leading a systematic life with medication compliance, nutritious diet, and recommended exercise programs would be definitely beneficial. So systematic. So it's C2 vocabulary. Use these words. How to use this one is very important. Implementing a systematic life. So like that. Following a systematic life. Leading a systematic life. Then next. Come on, anybody. I'm giving you time to speak. Next one is ignorance. Ignorance is C2 vocabulary. It means lack of knowledge. On admission, comma. Yeah. On admission, comma, he complained about pain in multiple sites. That is what Musiba, I told you, no, there are some mistakes. On admission, comma, he complained about pain in multiple sites. Comma, for which medications were prescribed, P-R-E-S, prescribed. Yeah. Next one. Next one is 20. Is it 20 or 21?
Systematic planning is crucial to obtain the objective in a fruitful way.
Yeah, you can just type that one. So 21 is ignorance. Ignorance. Yeah. 21 is ignorance. Ignorance. Ignorance is not the answer. Ignorance is not the answer. You have to be knowledgeable regarding your health because it's of utmost priority. You cannot say, I don't know, because it is your health that matters the most. Your health is our fundamental priority. So we recommend a quality diet, a nutritious diet, and regular exercise for at least 30 minutes on a daily basis. Just medication is not sufficient. In addition to medication, diet, nutritious diet, and regular physical exercises are equally important. So that is how you can say. That is ignorance. 21. Anybody can speak on ignorance? Or any other word if you have already prepared. Next one is hinder. Hinder means obstruct.
Hinder.
Yeah, come on. Hinder. This is also C2 vocabulary. Yeah. Ignorant, hinder, any word you can take. I don't know, you are tired or I am tired, I don't know. Come on. Don't stay silent. These words are used for your, I'll show you what the important things I'll tell you after, at the end of the session, how important these things are, you will never imagine.
Hello?
Yeah, carry on, Anastasia.
Ignorance to exercise regimen has hindered the mobility, her mobility.
Okay. That's good. Next. Hinder, hindrance. Hinder, hindrance. Hindrance is the noun, hinder is the verb. Any word you can use.
If you don't take proper wound care, it may hinder the healing process.
Very good, excellent. And the implications will be hazardous. Continuation. Implication, next one, 23 is implication. Yeah, next one, come on. Anybody can speak. Any word you can speak.
Multiple injury hindered the mobility of the person.
Yes, that's good. That's good. Implication, this is also C2 vocabulary, number 23. Very good. Implication, imply, implication. That means it will result to. It will result in. The implications of
Unhealthy lifestyle.
or irrefutable. Yeah, Nusiba.
Unhealthy lifestyle has got negative implication on our health.
Very good. Very good. Anesthesia, not ignorant, ignorance. Ignorance.
Yeah.
Yeah,
Yes.
next.
Yeah, if you don't rest enough, you will not actually hinder your performance in exam.
Yes, very good. Very good. Yeah. Anybody is going for a 13th batch? There's a crash course I'm giving now for these 4 days. And those who are going for the 27th test date, you can contact me for a short-term course. Otherwise, there are the regular courses of 1 month, 2 months, and 100 days. If anybody is interested, you can get back to me. Okay. Right. Joseph Stanley, can you unmute? Can you tell me what is the benefit of this session? Do you find? Joseph Stanley.
Sir, yes, sir, it is actually very useful, sir.
Huh?
It was a very useful session for me.
Yes, yes. So how does it benefit you? Because you just joined for 4 days, 5 days.
Yeah.
So how is it benefiting you, and you did not leave from this class even for a second? You are there right from the beginning, from the time you joined, and you are steadily listening the session. Yeah.
Yeah, previously I doesn't know these kind of words to use. Present I came to know we can use this.
Okay, fine. That's good. Yeah, come on, next. 2 more words to go. Implication. Implication. The after effects or implications of non-adherence to medication regimen would be detrimental to your health. So like that, implication, C2 vocabulary. Then next one is trigger. Trigger.
This one is new.
Trigger is C1 vocabulary, means to cause something to start. Yeah, come on, anybody.
Have you noticed any particular trigger leading to this symptom?
Yes, very good. Can you type this sentence, please? So this is the common word used by many nurses. So this sentence can be useful for them. That's a good sentence. So 23, trigger. This is C1 vocabulary. C1 vocabulary. This is a little lower level, but it's good word. Trigger. Yes. Thank you. Next. Anybody else? Implication or trigger?
Expressed emotion triggers the mental illness. Expressed emotion by the family members triggers the mental illness.
Yes, definitely, definitely. Ill treatment or negative treatment triggers wild feelings and negative feelings or negative emotions. Yeah. Next one is worsen. Worsen, W-O-R-S-E-N, worsen. This is also C1 vocabulary. We are coming to C1 vocabulary now. Worsen. That is 24. This is worsening the condition. The condition will be worsened, something like that. C1 vocabulary. The worsening of the condition has been observed, noticed. Deteriorated, the same thing. Deteriorated, worsening.
You are advised to take an appointment if your condition worsens.
Yeah. Yes, deteriorate is also C1 vocabulary. Yes, of course. Yeah, next. Next, come on, come on. Fast, one more word to go. 25. Deteriorate. That is also C1 vocabulary. So you are activating your words. Use these words, write down these words, and you use 20 words C1 and 20 words C2 in your speaking session. And who will stop you from getting A grade? I challenge. That's it. And all of you remember our new institute in your prayers. We are going to start.
Postoperatively, his condition deteriorates.
Post-operatively, the condition deteriorated. Okay, fine.
Okay, his condition has worsened due to his not compliance with his medication.
Yeah, Amira Ali, where are you from?
I'm from Sudan, but I live in Manchester, in UK.
Okay, there are many Sudanese. Oh,
Yes.
they really, there are many students. There was one doctor also. I don't remember her name now. Difficult. Okay, that's very good. That's very good. Work hard. Okay. Yes. Yeah, right. What is this? Mira, sedentary. Yeah, sedentary is another word. Means sedentary lifestyle. Yeah, that's fine. That's fine. You can take that another word. 26. Sedentary. Okay. Sedentary is what vocabulary? Sedentary is C2 vocabulary. Sedentary is T2 vocabulary. Yeah, you can use sedentary when you are speaking. Your sedentary lifestyle is the fundamental reason for your present condition. For your condition, for your present condition, in addition to excessive eating habit, sedentary lifestyle has sedentary lifestyle is one of the reasons. Okay, or these two things are the reasons. So eating voraciously and sedentary lifestyle. Voracious eating and sedentary lifestyle are two fundamental reasons for your obesity and increased body mass index. So, right. I think so. Let us call it a day. It is 23:26. But before you leave, just share your experience. Okay, share your experience one by one, and then yes, yeah. So first, let us start with Amira Ali. Yes, Amira Ali, can you share your experience? What you benefited and how was the session useful for you?
Yeah, my name is Amira. I'm from Sudan, and I was working as a doctor in Sudan and in Saudi Arabia for 9 years in A&E. Regarding your session today, really, I start doing my practice by my own self. But when I saw your invitations, immediately I joined your session. And to be honest, it was very, very useful and helpful. And thank you so much. I do appreciate your help and support regarding this exam.
Yes, thank you very much for sharing your opinion. Next, Anastasia Kelechi.
Hello?
Yes, Anastasia.
I must confess, this is a wonderful section and a capacity building section. Thank you so much.
I did not do anything. All the things you only did. I just gave you one word. You're mad. Okay, right. That's fine.
Right.
Yeah, next, Blessing Yerseba.
Oh.
Blessing.
Hello, sir.
Yes, dear.
It was a wonderful session. I learned a lot.
Okay, right. Chaitra Gowda. Chaitra Gowda. Are you on duty or busy? Yeah. Yes, I'm on duty. I understood. Otherwise, you would have spoken something. Yeah, Farid, Dr. Farid. I'm scared to give you the mic, but I have to give you. Otherwise, you'll kill me. Yeah. Only 1 minute, okay? Not more than 1 minute.
Sir, your class is undeniable, great. and we must watch relentlessly. Otherwise, it will be devastating for our career, and we should not be sedentary. And if we sedentary, it can hinder or all learning. And so it was great because I have learned a lot of things and irrefutable. I was slightly confused, irrefutable and irrefutable.
Yeah, fine. That's time up for you. Next, Manasa.
It
I'm
was
calling
good.
in the order. Yeah, Farid, finish your time up. Your time
Okay.
up. Okay, Manasa. Godati Manasa. Manasa also joined today itself. Yeah, Manasa, share your experience. This is your first class. Hello, till now you are participating very nicely. Where did you go? Okay, you don't want to share your feelings, huh? Yeah. Next, Joseph Stanley John. I think she went for water or something. Yeah, Joseph Stanley. Joseph Stanley. What happened is nobody able to unmute. Manasa, Stanley, Meera Manoj. Meera Manoj. Yes, please.
Thank you, sir. It was a very good class. Thank you.
Okay.
Good
That
night,
was the
sir.
short. Yeah. Yeah, share. Continue.
Good night, sir.
Yeah, okay, fine. Pranita.
Hi, sir. Good evening.
Yes, Pranita.
Thank you so much, sir. C2 vocabulary. Actually, I don't know how. Already, I'm listening so many days onwards, but I can't apply. But I don't know better sentence formation, so that's what I didn't participate today, sir. And definitely, I will.
1 minute. Are you in the bullet train already, which is going to be started next year? You're going so fast. What's the problem with you? Little slow down. Yeah, come on. I know you are happy. I don't know why, but just slow down your speed, okay? Yeah, tell me.
Yes, sir. Class is very nice, sir. But after I will apply, sir. Please C2 vocabulary with sentences. Now I
Yes.
don't know proper sentence formation, so that's why I didn't participate today very well. Thank you so much.
Yeah, you were a silent spectator. Very good. No problem. At least you are silently listening to how people were participating. That's okay. Yeah, Manasa. Last call. Joseph Stanley. Last call. Yes, that's the end of this session. See you all. Good night.